Okay, good afternoon. I'm going to discuss custom implants and instrumentation briefly. I will disclose that I have financial support from many of these companies. So we're talking about the rise of the machines in the operating room and making less room for surgeons. We have to understand that we can talk about computers and robots and custom implants, but there are a variety of systems that are available. They're not all the same, but in essence they all involve using some sort of external tractor beam and a computer to tell you where the bone is in space. But it creates a lot of bulk in the operating room. So we have to decide which new technology that we're using is effective, and we all have excuses for why we do not want to use new technology. And we have to decide and prove to ourselves that it's going to be relevant. The data right now for navigation seems to be promising, but as Dr. Ruddy showed, it has a long way to go in terms of beating what we've done so far. And we all know that technology continues to evolve. Computers do not look like this anymore. They don't fill an entire room. Cell phones aren't this big anymore. So they can continue to get better and improve. This was perhaps the first laptop, and we know that things can get smaller and smaller. But at the same time, technology can also die. The Betamax, the VHS tape, and now even the CD is becoming less and less commonly used. So we have to find out which technology is the right technology. So we believe that navigation will become the standard of care in joint replacement when it becomes user-friendly, faster, cheaper. But is there another option? And I'm going to discuss about the pre-navigated knee replacement. So there are several patient-specific knee replacements and partial knee replacements on the market. I've listed a few here. Most of these still require the use of standard instrumentation and off-the-shelf implants. I'm going to discuss what one company is doing, Conformis, where they use not only custom jigs but also custom implants for their patients. So here's an example of the Biomet system. You get a custom jig that allows you to place a couple of pins, that allows you to place the standard jigs and then put on a standard implant. And the Otis Med from Stryker now has a similar concept. The Conformis technology is somewhat different in the sense that a CT or MRI scan will map out the bone morphology and will understand where the defects are. Once they have that, they can design a patient-specific implant that perfectly matches the contours of that bone. So it's a patient-specific implant. Once you have the patient-specific implant, you can then create a patient-specific jig that will allow you to cut and prepare the bone to place that implant on. These jigs are disposable. They match the implants that they are designed to create perfectly, and they fit on the bone perfectly. And then cuts are made using the standard sort of instrument saws, and then a final implant can be placed onto the bone. So why patient-specific implants? It allows for superior fit. You get exact tibial coverage, it'll eliminate subsidence and eliminate overhang. It allows you to be bone preserving. It allows you to restore the normal kinematics for that particular knee. And it simplifies the procedure with less instrumentation. Is it superior? Well, we've shown in some studies that if you have a better fit, you can have better results. You can restore the patient's kinematics for that individual person almost to their pre-disease condition. Here's an example of different shapes of people, men, female, medial and lateral, and current implants. They don't quite match where they are. These are femoral fit of unicompartmental implants. On the tibial side, we do a slightly better job, but still there's a varying size discrepancies. On the lateral side as well, a discrepancy in the size of the implants in that individual patient. What have we learned from the gender information? That basically, the better the fit, the less overhang, the less subsidence you might be able to see. So no one should argue that a better fit is not a good thing. So patient-specific technology has the potential to improve key aspects of knee replacement. We can improve the fit, we can preserve the bone, we can restore the patient's native kinematics, we can improve their alignment, it can simplify the surgery, reduce OR time, and reduce OR inventory and supply. It's my prediction that within 5 years, 1/3 of knees that we do will have some sort of customization done. It will reduce our investment demands, it can reduce the cost of the entire system, but most importantly, I think our patients will start demanding that they have custom implants. Thank you.